All right, so hello, and thank you for taking the time out of your busy schedules to listen to this webinar entitled Protecting the Mental Health of Employees During COVID-19. This webinar is presented by Ottawa Public Health in collaboration with Workplace Safety and Prevention Services. Bonjour, bienvenue, et merci de vous joindre à nous. Ottawa Public Health honors the Algonquin Anishinaabe people on whose unceded territory the City of Ottawa is located. Santé publique rend hommage au peuple algonquin Anishinaabe de la ville d'Ottawa étant établi sur son territoire ancestral. OPH extends this respect to all First Nations, Inuit, and Métis peoples, their ancestors, their elders, and their valuable past and present contributions to this land. OPH recognizes the impact and legacy of colonization and ongoing systemic racism on the health and well-being of First Nations, Inuit, and Métis people, and is strongly committed to public health actions that promote reconciliation and the health of First Nations, Inuit, and Métis people and communities. So the COVID-19 pandemic has changed our world and the way we live, work, study, and play. Many organizations have required employees to work remotely, while other employees have continued to provide essential services throughout the pandemic. As a result, individuals are experiencing increased levels of stress, anxiety, and loneliness that are impacting their mental health. Why do we need to pay attention to the psychosocial risk factors facing frontline workers and those working remotely? What actions can employers take to provide mental health support while keeping employees engaged and productive? And how can individuals increase their resilience and manage the stress of these unprecedented times? These are all questions which will be answered during our presentation today. Without further ado, I would like to introduce our speaker, Janet Carr. Janet is a registered nurse with over 20 years' experience in assisting large and small organizations to create healthy and safe workplaces. She has worked as a public health nurse with Ottawa Public Health and also as a nurse consultant with the Public Health Agency of Canada. Janet is currently a workplace mental health consultant for WSPS, specializing in the promotion of psychologically safe workplaces and the prevention of mental harm at work. She is certified by the Mental Health Commission of Canada as a mental health first aid instructor, and is also a Canadian Mental Health Association certified psychological health and safety advisor. Janet provides consulting and training services to organizations that want to create a mental health and safety strategy or to implement the national standard for psychological health and safety in the workplace. One of her best stress relievers during this challenging time of COVID-19 is to spend time with her toddler and infant grandchildren, even if it can only happen virtually. So welcome, Janet, and thank you very much for being with us today and presenting some of this important content.
Thanks very much, Chanel, and good morning, everyone. I appreciate the invitation to talk with you this morning about protecting the mental health of employees during COVID-19. And as Chanel mentioned, I worked for many years with Ottawa Public Health, so it feels like a little bit of a homecoming when I have a chance to collaborate with OPH and to talk about this subject this morning. So I'm just going to switch to my PowerPoint presentation. So I'm going to be talking about employees working remotely, but also about those who are working on the front lines. And many employees have been working remotely for more than 6 months now. This photo shows a very calm home scene with young children quietly entertaining themselves in the background while mom is trying to work. I think the day-to-day reality has been quite different in many homes. I think what's been more the norm is mom is trying to participate in a video teleconference in the morning while feeding the baby on her lap, and her toddler is coming in and out of the room in various stages of undress, while the dog is barking because someone has just rung the doorbell. Working from home has not been smooth for many of us. It's been a real transition. Essential workers on the front lines have continued to report to work, putting themselves at increased risk of contracting the virus. There's been little time to prepare, a lack of proper protective equipment, and in some cases, little training. I think we're all feeling a little vulnerable right now, and today's discussion could trigger some mental health responses. So if you're feeling distressed, please reach out to a family member, friend, or colleague, or contact your local distress center. And I'm just going to put up on the screen the number for the Crisis Services Canada to obtain a listing of national crisis hotlines. You can see the agenda of what I'll be covering today. I'll start with some current challenges to our mental health, but then I'd like to focus on what you can do and what resources are available to support you. While we've heard the term social distancing for the last couple of months, more and more people are choosing to emphasize the importance of physical distancing, but still socially connecting. Not everyone has the luxury of staying home to protect themselves, and essential workers must keep their distance from one another while still going to work. It's impossible to discuss frontline workers without paying tribute to the courage, commitment, and compassion of those who've continued to work throughout the COVID-19 pandemic to provide essential services while the rest of us have been able to work from home. Our heartfelt gratitude goes out to all of you who are working on our behalf so that we can stay home and stay healthy and safe. And I think when we think about frontline workers, we immediately think about doctors, nurses, paramedics, personal support workers, but it's also our first responders, our police, our firefighters. It's our food processors who allow us to continue to have available food, our grocery store staff, bus operators, internet and phone repair staff, and cleaning staff, just to name a few. And I'm sure that for some prior to COVID-19, you never considered that you'd actually be providing essential services during a pandemic. As Chanel mentioned in the introduction, it really is an understatement to say that COVID-19 has changed our world. Not only has it changed how we're working now, but it will undoubtedly change dramatically our way of working in the future as well. With this pandemic, the simplest tasks have become much more complicated. And I think about picking up groceries, visiting the dentist, getting your hair cut, keeping up with schoolwork and trying to work remotely, and always with the 2-meter buffer zone around us. I never thought a year ago that I would need to watch a YouTube video on how to safely disinfect my groceries after bringing them home from the grocery store. The frontline worker has all those same challenges, in addition to being expected to show up at their usual place of work and perform their job duties under highly unusual circumstances. When I'm talking about remote work, I'm referring to full-time, part-time, or project-based work that a person is doing from outside their organization's office, and of course, relying on the internet to stay connected. Most have had to adjust very quickly with very little time to prepare, sometimes lack of proper equipment, and little training to go along with it. And all of these challenges are contributing to increasing levels of stress and anxiety for many, and having a significant impact on our mental health. In fact, a survey conducted by the Royal Ottawa Mental Health Centre last spring showed that half of respondents had major signs of depression and a third had signs of anxiety disorder. I want to talk to you for a few minutes about the enhanced authority of public health. The Occupational Health and Safety Act has a requirement that employers have a general duty to protect workers. Within the federal context, the Canada Labour Code Part 2 has similar language that speaks to the requirement for the employer to ensure the health and safety of all employees. However, none of this legislation provides any specific guidance about managing health and safety in the midst of a pandemic. Public health is the new authority that all levels of government, workplaces, and communities are listening to. The Public Health Agency of Canada, the Chief Medical Officer of Health, Ontario Ministry of Health, and local health units are providing to all elements of society. Political agendas are taking a back seat to health promotion and protection legislation and scientific evidence. People are also listening to the media. As well as reporting on the recent number of COVID-19 infections, both locally and across the country, the media are focusing a great deal of attention on the threats to our psychological well-being. Mental health is front and center during this pandemic and becoming a prominent theme as all ages in society struggle with these increased levels of stress, anxiety, and depression. And we know that positive mental health is critical to our overall health. I like the World Health Organization definition of health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And there are really three components to overall health. There's our physical health. This is the most visible part, of course, because it refers to the physical condition of our body and how well we take care of it. Mental health, which is our psychological and emotional well-being, what's going on in a person's mind. And then finally, our social health, which is the ability to form meaningful social relationships with others and to behave appropriately in social situations. So although mental health is only one component of overall health, it has considerable impact on overall health when it's not nurtured and maintained. So I'd like you to imagine for a moment your overall health as a three-legged stool. By design, the stool is sturdy, it's balanced and supportive. However, if one of the legs were broken or missing, then the design would be compromised and unbalanced. In fact, the remaining two legs would have to work harder to support the weight, and hence the stool would not be functioning optimally. The same is true of our mental health. This, once again, is a World Health Organization definition. And as you look at that definition on the screen, I'd like you to just focus in on a couple of phrases. Cope with the normal stresses of life. During this COVID-19 pandemic, we're no longer trying to manage the normal stresses of life, but rather we're struggling with unprecedented upheaval in all aspects of our lives. Contributing to community. It may be a little more difficult now with the physical distancing limitations that are in place, but fostering social connections are essential here to maintain our feelings of productivity and fruitfulness. We're seeing people from all walks of life stepping up to help others, especially those who are less fortunate in our communities. We're also seeing businesses evolving their product lines to meet the need for vital equipment and supplies. Speaking about the stresses of life, on the screen you'll see some of the stressors that many people have been dealing with these past few months. Fear of contracting the virus is why many are working remotely today, staying at home to reduce our contact with others, and limiting our outside contact to only essential activities. Some people might be in a higher risk category due to their age or a pre-existing medical condition, and others are worried about young children or elderly relatives. Frontline workers don't have the luxury of staying home and have had difficulty accessing some appropriate personal protective equipment to protect themselves while they carry out their duties. And that's proven to be a huge stressor for those in contact with the public. Not only an issue in high-risk environments such as healthcare, but also in groups such as transit workers and grocery store cashiers. Some essential workers have underlying and invisible health conditions, and they don't necessarily want to disclose that, and so may continue with their job duties, putting themselves at increased risk. Many are concerned about bringing the virus home to children, to partners or elderly relatives. Some even resorting to hotel or trailer accommodation, or living in repurposed garages or basements temporarily to avoid infecting others at home. There are many losses and changes to deal with during this time, not only related to grieving the loss of someone who's died from COVID-19 or other causes, but also the loss of not being able to gather with loved ones to bring closure through our usual funeral rituals. In the case of healthcare workers, they might also be experiencing the loss of patients and residents under their care. We are also experiencing losses related to disrupted schooling and lack of playmate contacts for children, the demise of our face-to-face social connections, and some of our usual hobbies. Many businesses have been forced to close down their operations, either entirely or partially, and to lay off staff. And a large number of employees are no longer receiving a regular paycheck and struggling to make ends meet for basic day-to-day expenses. Having enough money for groceries and rent or mortgage payments are now problems keeping us awake at night. Even those who have a roof over their head can be worried about close quarters. For example, is it safe to touch those elevator buttons in my condo building? Or the risk of overcrowded public shelters. And although we're telling people to stay at home to stay safe, if it's a domestic violence situation, staying at home isn't necessarily a safe option. Some frontline workers have had hours reduced or been forced to give up alternate part-time positions to prevent cross-infection of vulnerable populations. Not all essential workers have been eligible to receive pay bonuses, despite putting their health at risk. We are naturally social beings, so this requirement to self-isolate at home and maintain physical distancing outside the home can really compromise our need for social connections. There's been an increase in alcohol and drug consumption as people have exhausted their usual mental health coping strategies and turned to substances to self-medicate for relief. The closure of schools and daycares has created a whole new host of challenges for parents who are trying to work remotely or for essential workers who must report to work, but they also have children who need to be cared for at home. And these stressors are having a significant impact on our health. We know that stress can impact our bodies, our minds, and our behavior. And our stress response prepares our body to react to emergency situations. So we often hear about the fight, flight, or freeze response. However, chronic stress over long periods of time can have a negative effect on all parts of the body. So, for example, stress can result in increased blood pressure, increased heart rate, and an increased risk of heart attack. In terms of our immune system, it can result in a reduced ability to fight infection and recover from illness. Joints and muscles can be impacted by stress as we become much more tense and tighten up when we're feeling in a chronic state of stress. In terms of our mental health, we know that the stress due to the uncertainty and lack of control during these unprecedented times can lead to increased levels of anxiety, especially for those who are already struggling with mental illness. There's an increase in the number of people describing feelings of low energy or sadness when their usual coping techniques are not available to them. Before COVID-19, we were seeing almost 4,000 suicides a year in Canada. Suicidal ideation is becoming a more pressing concern as the pandemic period continues, and people are experiencing growing despair in their circumstances. According to an Ipsos poll in April of 2020, 54% of Canadians were feeling lonely or isolated during the COVID-19 pandemic, and that number rose to 68% in the 18 to 34-year-old age group. Now, technology is helping somewhat, with 93% of us using technology to stay connected. In terms of our cognitive functioning, the continuous presence of stress hormones such as cortisol and adrenaline may alter the operation and structure of some aspects of the nervous system. As a result, people who are chronically stressed may experience confusion, difficulty concentrating, trouble learning new information, or problems with decision making. And I think many of us have experienced that as we've had to deal with this over the last few months. In 2016, the Conference Board of Canada did some research, and it indicated that depression was costing the Canadian economy at least $32 billion a year, and anxiety was costing $17 billion a year. And that was well before COVID-19. So the costs right now to our economy would be quite staggering, I'm sure. We don't know how long the long-term consequences of having to be isolated for extended periods of time. However, the Conference Board of Canada, Mental Health Commission of Canada, and WSPS conducted a COVID-19 impact on mental health survey in May of 2020. And 84% of respondents reported concerns had worsened across 15 mental health factor scores. The greatest concerns were well-being of the family, 24%, the future, 23%, isolation and loneliness, 21%, and anxiousness or fear, 21%. So hopefully you're not feeling it's all doom and gloom. There are certainly things that we can do to help our mental health and get the support that we need. So let's start with what employers can do to mitigate the risk to mental health and protect their employees. So especially during this time of upheaval, we really need leaders who have emotional intelligence, those who are self-aware, able to communicate with empathy, and manage relationships positively. Communication is more important than ever as your employees carry out their tasks in the midst of such overwhelming societal challenges. Staying connected with staff is paramount, and communicating often about the current state of the organization, what changes are occurring, and their impact on staff will help employees to feel more supported. It's also important to communicate how critical their roles are and thank them often for their exceptional dedication and courage. We expect our leaders to have all the answers, but unfortunately there's no playbook for operating during this COVID-19 pandemic as you try to navigate the path forward. Remain calm, provide reassurance, and be visible by walking around. Ask your employees what kind of support they need and invite their involvement and input in coming up with practical solutions. Be flexible in accommodating those with hidden health conditions whose immune systems could be compromised. I really like the advice provided to leaders by Dr. Bill Howitt, founder of Howitt HR, and Louise Bradley, president and CEO of the Mental Health Commission of Canada. They said that being kind is more important than being right, and being vulnerable is your superpower. So this is a time to show your own vulnerability as a human being by empathizing with those reporting to you and being kind. Demonstrate flexibility in dealing with the difficulties your employees might be experiencing as they try to juggle their personal responsibilities and work demands during such a tumultuous time. Encourage staff to connect with one another and their manager on a regular basis, even if they can only do it virtually. Normalize anxious feelings and provide training where it's needed. Think about obstacles employees might be experiencing as they carry out their duties and consider solutions that can be implemented in a timely manner. Muster all the resources available to provide a safe and healthy environment as possible to help employees feel valued and engaged. For those working in essential positions, think about job rotations where it's possible to help relieve the stress related to higher pressure situations while still respecting infection prevention and control guidelines. Try to ensure that staff take much needed breaks regularly and understand the importance of taking their days off as scheduled. Encourage your workforce to take time to focus on their self-care needs and be a good role model in making your own self-care needs as a leader also a priority. Remind employees about the availability of employee family assistance programs if you have access to one, and communicate what other community resources are available to staff to help support them during this difficult time. In addition to providing external resources, think about the importance of building your own internal resilience to help you cope with everything that's going on. So let's talk for a minute about the concept of resilience. We hear this term used a lot, but what is it exactly? Resilience is the capacity to recover quickly from adversity or life's challenges. It's the ability to bounce back and continue to cope well and maintain good mental health, even in the face of crisis, without long-term negative consequences. And as I mentioned earlier, during this COVID-19 pandemic, there are many situations that will test our resilience, and you can see some of those listed on the screen. However, building resilience may have some preventative mitigating impacts towards these situations. Now, the good news is, even if you don't feel you're very resilient right now, resilience is a collection of skills that can be learned. You can develop resilience by learning to train your attention on more positive aspects of your life and decrease the negative thoughts in your mind and bring greater focus on the most meaningful aspect of an experience. Let's look at an easy way to start to increase your resilience and consider building self-care into your daily routine. So on this slide, you'll see a number of different examples of self-care activities that may be especially helpful during this pandemic. And this is by no means a comprehensive list. Although the title is Employee Self-Care, these measures are just as important for employers as for employees. Most of these suggestions are backed by scientific research as to their benefits, and you'll notice that many of them have no cost associated with them. I'd like to add one more to the list, and that is debrief stressful moments. Whether you're working remotely or on the front lines, it's important to have someone you can talk to if you have experienced a particularly stressful event in your day. Let's talk about a few other self-care activities. Going for a walk and getting outside, preferably in nature, has been shown to have real benefits, not only on our physical health, but also for our mental health. There's enough science about the health benefits of nature to get the attention of the medical profession. Watching a comedy and limiting the amount of news we take in. It's hard to turn on the TV and not see some news about COVID-19. But we know that humor is a great medicine and laughter is contagious. Emotional contagion is the phenomenon of having one's emotions and behaviors triggering similar emotions and behaviors in other people. So surround yourself with people who have a positive outlook and don't be afraid to laugh and to see the humor in some of our situations. Connecting with family and friends. Many of us have become physically separated during this time from friends and even from family members and have had to find other ways to stay connected. Platforms such as Zoom and Adobe have helped to keep people in touch with one another, but it's also important to balance some of these visual platforms with other forms of communication, like texting, emailing, talking on the phone, and communicating at a distance outside. That brings us to the self-care activity of consciously being kind to yourself. Watch your self-talk. We tend to be very hard on ourselves without realizing it. And these unconscious negative thoughts can take a toll on our mental health. Taking time to think kind thoughts about yourself and your loved ones has psychological and physical health benefits. However, sometimes it can be difficult to make self-care a priority. And you'll see here some barriers that people have identified that makes it difficult for them to pay attention to their own self-care. No time is a big one. But if you're telling yourself you have no time, remember that self-care can take only moments of your time. Just take a few minutes to consciously breathe deeply, for example. We know that when we're stressed, we breathe with very shallow breaths and our bodies unconsciously tense up. Physically distancing. If you would typically get together with a buddy or a friend to chat over coffee or dinner or exercise at the gym, try new ways to do your usual activities through social networking platforms. No hobbies. Think about volunteering from home. Many cities are advertising opportunities for people to help meet the needs of the community. Sleep difficulties. Even though we know sleep is important, the increased anxiety during this time may disrupt sleep for many, and the lack of sleep can then increase the impacts of stress. Dr. Jody Samra of My Workplace Health has put together some videos with tips for better sleep that you might want to check out. Lack of money. If you've stopped working because of COVID-19, investigate what government financial options are available to assist you during this time that you might be eligible to apply for. If you're having trouble moving to action, consider making a plan. I think we often know in theory what it is we should be doing, but it's sometimes a little more difficult to actually get around to doing that. So if you want to focus on taking care of your physical, mental, or social health, it's important to have a plan of action. And if you write it down and tell others about it, you're more likely to follow through with it. So let's take a look at a sample self-care plan. Many people have mentioned walking as a form of self-care. It's important to think about the practical first steps to get you out the door and what can make it easier for you to be able to maintain that new behavior. So you can see some suggestions there about what those practical first steps are, when you might want to commit to doing to doing this, and what could actually help motivate you to maintain it. Gratitude moments can affect the neuroplasticity of the brain and reconfigure it to feel more positive about life. There are many gratitude apps available to help us appreciate what we do have rather than just noticing all of the things that we don't have at the current time. What about reaching out to support others? There are some helpful tips in reaching out to others at work or to our friends and family. Having a workplace buddy to connect with can have a positive impact on our mental health. If employees have someone that they feel comfortable to confide in and feel supported by, it can have a positive effect on their mental health. Gallup research has identified that having a best friend at work was one of the major criteria that kept people engaged at work. From an employer perspective, consider implementing a buddy system at work. Encourage people to pair up with each other and ask them to stay connected. Listening without judgment. While this may seem fairly simple and straightforward, it's actually a lot harder to do than we think. Most of us listen while thinking about how we're going to respond to help fix the problem, when it's often most powerful if we just listen and are empathetic to another's experience. Avoid giving advice, and we all love to give advice, but as a good listener, you don't need to give advice. Consider asking the person how you can best support them, and remember to direct people to help through their EFAP or provide some online resources. Provide information about online resources. For example, the Mental Health Commission of Canada is offering a new online course to essential workers at no charge. It's part of their crisis response virtual training, and they have a course on caring for others, caring for yourself, and caring for your team. These courses are designed to help people deal with these new challenges and are based on some of the successes that have been seen through programs like Mental Health First Aid and the Working Mind. And this is most certainly available to essential workers anywhere in Canada. Finally, simply reassuring people that the heightened experience of stress and anxiety is a normal response to a very abnormal situation. This is the first time any of us have gone through something like this, and these overwhelming emotions and concerns are our body's response to keeping us safe. It's okay to not feel okay right now. Let's talk about some of the internal resources that might be helpful to you. This is a good time to look at what existing policies and procedures you have already that you can either utilize or adapt. Do existing policies need to be revisited, or do new shadow policies need to be developed to address some of the situations that employees are dealing with? Your organization might never have needed a policy about how to order supplies from your work, from your home office. But now the working remotely from home numbers have changed that situation, and there may need to be new policies to address it effectively. Human resources. Your HR department can assist with any accommodation issues and also remind employees about their benefit allowances, time off allotments, etc. If you have unions, health and safety committees, reach out to them and take advantage of their input and leadership. Employee and family assistance programs. Remind employees and managers about your EFAP and how to access services. If no EFAP exists, consider developing a list of community resources using 211.ca to find out what resources exist in your own area. Wellness programs. Promoting health and lifestyle practices within your organization is even more important now as we try to ensure that we maintain a strong immune system. Consider a walking challenge to promote physical activity. Online or virtual training. Many organizations are offering webinars and virtual training courses on mental health topics that might be helpful. For example, WSPS has developed virtual workplace mental health courses on topics such as raising awareness and workplace mental health, how managers should respond. In terms of external resources, This is a list of resources that have been vetted and are credible, Canadian, and many are available at no cost. This photo shows a handout from WSPS called COVID-19 Mental Health Resources. As well, Ottawa Public Health has a wonderful resource entitled Managing Through COVID-19, How to Support Your Employees' Mental Health, an employer guide. Mental Health First Aid, COVID-19 Self-Care and Resilience Guide from the Mental Health Commission of Canada has a great list of self-care activities, a self-care and resilience plan worksheet, and national, provincial, and territorial crisis lines, as well as other mental health resources. There are numerous mental health apps out there. A couple of meditation apps are Calm and Headspace. As well, there are a number of resources that offer cognitive behavioral therapy virtually. And a couple of examples of those are Starling Minds and Beacon. Bounce Back is a free online skill building program managed by the Canadian Mental Health Association that's designed to help adults and youth 15 and older manage low mood, mild to moderate depression, and anxiety, stress, or worry. There's also support for frontline healthcare workers. There's a volunteer network of Ontario-based mental health professionals who are dedicated to supporting our frontline health workers during this crisis. Their goal is to help frontline workers feel connected, supported, and they're providing short-term one-to-one teletherapy at no cost for those who need it. Mental health in the COVID-19 pandemic from the Centre for Addiction and Mental Health is designed to provide information and suggestions about how best to cope in this difficult time. It answers many questions such as, how do I talk to my children about COVID-19? Or how can I support a loved one who's very anxious about the pandemic? And then finally, the Wellness Together portal, Wellness Together Canada portal. This provides immediate mental health and substance abuse supports 24 hours a day, 7 days a week to Canadians of all ages and at no cost. It connects Canadians to peer support workers, social workers, psychologists, and other professionals. It links to organizations such as Homewood Health, Step Care programs, Kids Help Phone, just to provide that confidential support to Canadians across the country. So this morning I've touched on just a few of the many workplace mental health resources that are out there, but please feel free to contact me if you have any questions or need further information. I have put my email address on the screen, janet.carr@wsps.ca. And on that note, I'll pass it over to Chanel for some questions.
Great. Thank you so much, Janet. You provided a lot of useful tips, not only for employers, but also employees, and a variety of resources as well. So we really appreciate that. Thank you very much. So we're going to ask a couple questions here. But I'd like to actually start with, if you could take a few minutes to explain the difference between mental illness and mental distress. That's a question that we often get asked. So I was just wondering if you could take a few minutes to explain the difference there.
Sure. So we all start with mental health in our lives, and through various points in time in our life, we may experience situations that create mental distress for us. And we know that if that distress is serious enough and disruptive enough to our day-to-day functioning and goes on for an extended period of time, it sometimes meets the criteria of a mental illness. It certainly has to be diagnosed by a mental health professional to ensure that it meets the criteria of the Diagnostic and Statistical Manual of Mental Health Disorders. But mental illness is a diagnosed disorder, whereas mental distress is something that many of us can experience at different points during our life. I think in the workplace context, we just want to make sure that conditions in the workplace aren't creating undue distress on individuals that could lead to a mental injury at work, for example.
Great, thank you. Okay, so we're wondering, sometimes there's still a lot of stigma associated with talking about mental health in the workplace. So where's the best place to kind of start that conversation?
That's a great question, Chanel, because I think before you can really focus on mental health and creating a psychologically safe workplace environment, you really need to address any kind of stigma that's occurring in the workplace. We need to increase our mental health literacy. We need to understand that mental health issues aren't something happening to others out there, but in fact, it's happening to many of us. 1 in 5 Canadians, for example. And so it's really no different than someone having a physical illness or injury. And we need to start treating them similarly. I think as we talk about, as we try to increase people's literacy or understanding of mental health, it helps us to decrease some of that stigma. Hearing from people who have lived experience with mental health issues can also help people to see the human face to it and understand that someone who has a panic attack or someone who's has depression, it's no different than someone who has a physical injury, a broken ankle or heart disease, and we really need to start treating them similarly. So I would encourage organizations to start the conversation to help their employees understand that mental illnesses are legitimate illnesses, just as physical illnesses are, and to help people have a better appreciation that it's just part of our overall health. And as our physical health may falter from time to time, so might our mental health. And with support and appropriate resources, we can get back on track again.
Great, thank you. Okay, so what would be the best way to support a colleague who's struggling if you yourself are also not coping as well as you normally would? Because I know we're all probably struggle at some level on, maybe a bit differently on different days, depending on what's going on. But, if we notice that a colleague is struggling or having difficulty at work and we want to approach them, what's the best way to do that? And also maybe if we're not feeling our best, but we still want to try and be supportive of them as well.
Sure. And I what comes to mind when I hear that question is a saying that Dr. Bill Howitt has used in some of his webinars. And he has said, don't set yourself on fire to keep other people warm. Mm-hmm. And so it really speaks to how important it is to focus on our self-care. Another example is when we used to fly. We're not flying as much anymore right now, but the flight attendant would say, put on your own oxygen mask before you help others, because you're not going to be of any help to anyone else if you're not managing your own mental health properly. So in the situation where someone is struggling, but you yourself are struggling, acknowledge the fact that you may not have anything left in the tank to provide support to others if you're struggling yourself. But don't leave that person without support. If there is an employee family assistance program in your organization, remind them about that program and how to access it. If you don't have an EFAP, find out what community resources might be available, what's available internally to support them, what's available in your community from other organizations, so that you're able to direct that individual to appropriate help. Perhaps there's someone else as well in the organization that they're close to who they may be able to reach out to for some support, and just have someone who can listen and not feel that they're needing to jump in with any advice. So I think we certainly want to be conscious of how people are doing around us and reaching out, even just simple, are you okay? Or I've noticed you seem to be struggling today. Just simple ways of letting people know that we've noticed and that we're there to support them if they want to share with us what they're dealing with. But you do have to really focus on your own self-care And if you're not feeling that you're able to manage those conversations right now, do the same yourself. Follow your own advice. Reach out to EFAP. Reach out to a colleague. Reach out to a community organization. Try some of the online applications that are available now. As I mentioned, there's cognitive behavioral therapy that's available online. There's lots of different resources that we can take advantage of, so that your own self-care becomes a primary focus. And then once you're feeling a little more balanced and better able to manage, you'll be in a better position to provide that support to others.
Great, thank you. Yes, yeah, there are lots of resources available out there to support. So it's nice that there are different options for everyone, depending on what kind of support they would like or what they're comfortable with. All right, so what can employers do to support their employees' mental health if they're having to let staff go during the pandemic?
That's a really difficult one, isn't it? I mean, through circumstances outside of our control, some organizations have not been able to continue to operate. I would hope that organizations would have explored other options first before letting people go, perhaps decreasing hours. But in the situation where people have had to furlough staff, it's difficult on both sides. It's difficult for the individual who gets laid off, and it's difficult for the person who has to deliver that message. So I think as managers, we need to recognize that these are difficult conversations. We need to make sure that that we're feeling that to the best of our ability, able to have that conversation with an individual. Have already done some homework about what are some options from a financial perspective, what kinds of government programs might they be eligible for. This is where your HR department might be able to help you have that information. Communicating to that individual whatever information you have, whether this is going to be a period of anticipated just to be a period of a couple of weeks, or whether it's anticipated to be a much longer period of time. And of course, we don't, with this pandemic, really have all these answers, because it's we're kind of going week by week in terms of the COVID-19 pandemic. But just being, I guess, being empathetic to this situation as you're having to share that news with an individual, being as candid as you can, giving them all the answers that you have, thinking about not only what financial resources might be available to them, but also thinking about their mental health and how they may be taking this news and how they'll be managing at home without support. And so wanting to make sure that they feel connected to resources within the workplace, but also community resources. And hopefully being able to stay in touch with them, even if they've been furloughed, just to let the employee know that you're thinking about them, that hopefully things are going to turn around and they're going to be able to hire people back on. But letting people know that they're more than just a statistic, more than just a number in the workforce, that they are a valued employee, and that the organization is doing everything within its power to try and to stay in a situation that they're going to be able to eventually bring people back on board, and once again have that successful employer-employee relationship.
Mm-hmm. Yeah, that's really important. Thank you. All right, so you spoke a lot about different resources. You mentioned employee and family assistance programs, but how would you suggest getting more employees in a workplace to use the employee and family assistance programs that are available? Because I know sometimes employers will tell us we have all these services, but the employees aren't really making use of them. So do you have any tips for that?
Yes, I think when we have employees who are just being onboarded in a new organization, most organizations are really good to give them a really nice orientation, tell them about all of the benefits and all of the services available to them, including an EFAP if the organization has one. But then people tend to forget that this service is available to them. And so it's really important that organizations remind their employees regularly that there is this service, that in many cases it's available 24/7, reminding employees that everything is kept very confidential, that the employer will not know who it is that's accessing the services. They will simply know what number of staff have accessed the program, but no names, no topics that are discussed or anything of that nature. I think that's critically important, because if employees are concerned that some of what they might be sharing with an EFAP counselor has any way of getting back to their employer, that will certainly very quickly stop anyone from feeling any trust in using that service. So really emphasizing the confidentiality, emphasizing that the Employee Family Assistance Program is often more than just about counseling for mental health issues. There can be legal support, financial support, relationship guidance. There can be assistance with family members as well. So it's a great resource. It's also a great resource for managers, because if a manager is dealing with an employee who has a mental health issue, or they're concerned about their behavior, it's an opportunity for the manager to call the EFAP and say, without sharing names, but just describing the situation and saying, this is the situation I'm dealing with as a manager. I want to make sure I proceed in a way that's going to be beneficial to the employee. Can you give me some guidelines or some suggestions about how I might approach that? So it's a great resource for our managers as well. And just remembering that for those that don't have EFAP, that there is lots of other resources out there. EFAP is a wonderful resource to have, but unfortunately not all organizations might be able to access those services. But the 211 number that I spoke about earlier in terms of internal and external resources, you can either call 211, dial 211 on your phone, or go to 211.ca and then plug in the name of the city or the location that you're calling from, put in a topic for what it is that you're wanting to find information on, and then it'll give you a list of all the resources available in that location on that topic. So for those that don't have EFAP, not to feel that there isn't lots of other resources out there that can certainly help people out. But with EFAP, I do think we have to remind people regularly that that is there. And sometimes even just letting people know what the process is. I know some managers who've actually called their EFAP to say, I just want to be very clear so I can explain to my staff what happens when someone calls this number. And so they would walk them through the steps, and then they can then share that information with their staff and have people feel a little less reluctant perhaps to avail themselves of the service.
Great. Yeah, those are some great tips. Thank you so much. All right, so I think the last question I'll ask here is, you did speak about things that employers can do to help their employees through this pandemic in the workplace, but I just want to ask, what is the number one thing an employer can do to keep their workforce engaged during these challenging times?
I guess I'll go back to the comment that I made about being yourself, being the idea that you need to just be very candid and show who you are as an individual, show your humanity, show the fact that as an employer, as a manager, that you can really show your vulnerabilities as a human being. and so that people see you as being very legitimate in your conversation with them, very that you can really try to empathize with what it is that your employees are dealing with, and that you're trying your best to keep the workforce as healthy and safe as possible. The communication is really important, but I think people can quickly sense when it may not be genuine or authentic. So being as authentic as you can, speaking person to person with the individual, and being as sharing with whatever information you have goes a long way in helping people to feel that you're not holding back, you're being genuine, you're being authentic, and that as their employer or manager, you truly care about them as an individual, and that you are concerned about their psychological well-being as well as their physical health and well-being.
Wonderful. Thank you so much. Well, Janet, I really want to thank you and for presenting the content today. And I also want to thank our partners at WSPS, as well as the rest of the team here at Ottawa Public Health for making this session possible. I really thank everyone for joining us today. We hope you found this information useful. Merci de vous être joints à nous aujourd'hui. Nous espérons que l'information reçue vous soit utile. And I'd also like to highlight a website from Ottawa Public Health where you can get some more information and resources as well. So you can check out our website, ottawapublichealth.ca/COVID mental health for more resources. And you'll also find a dedicated section on there for workplace mental health. Janet, was there anything else that you wanted to add before we conclude the presentation?
No, just thank you once again, Chanel, for the opportunity to speak this morning. And as we all continue to move forward day by day in trying to navigate through this COVID-19 pandemic, whether you're working as a frontline worker or working remotely, to know that there are resources out there to help keep you psychologically safe as well as physically safe, and that eventually we will get there and see the end of this. And just to thank you once again for the opportunity to share some of that today.
Great. Well, thank you again for joining us and for sharing all your resources and knowledge with us. So we hope everyone has a great day. Merci et bonne journée.